Ibu-200, also known as ibuprofen, is a medication used to relieve pain from conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pains due to the common cold or flu. Ibu-200 is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. It is important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. If you are treating a chronic condition such as arthritis, consult your doctor about non-drug treatments and/or using other medications to treat your pain. Always follow the recommended dosage and take Ibu-200 with food or milk to prevent stomach upset. Remember to never exceed the daily dosage, and consult your doctor if you have any concerns or questions about taking Ibu-200. When taking ibuprofen, make sure to read all the directions on the product package if you're using the over-the-counter product. If your doctor has prescribed this medication, be sure to read the medication guide provided by your pharmacist before you start taking ibuprofen and each time you get a refill. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth, usually every 4 to 6 hours with a full glass of water unless your doctor tells you otherwise. Do not lie down for at least 10 minutes after taking this drug. If you have stomach upset while taking this medication, take it with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed by your doctor or the package label. For ongoing conditions such as arthritis, continue taking this medication as directed by your doctor. If you're giving ibuprofen to children, the dose is based on the child's weight. Make sure to read the package directions to find the proper dose for your child's weight. If you have any questions or need help choosing a non-prescription product, consult the pharmacist or doctor. For certain conditions, such as arthritis, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. If you're taking this drug as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you are using the non-prescription product to treat yourself or a child for fever or pain, consult the doctor right away if fever gets worse or lasts more than 3 days, or if pain worsens or lasts more than 10 days. Some common side effects of Ibu-200 include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that if your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. Ibu-200 may also raise your blood pressure, so it's important to monitor your blood pressure regularly and notify your doctor if the results are high. It's important to seek immediate medical attention if you experience any serious side effects, such as easy bruising/bleeding, hearing changes, mental/mood changes, signs of kidney problems, vision changes, symptoms of heart failure, or symptoms of liver damage. While a serious allergic reaction to this drug is rare, it's crucial to get medical help right away if you notice any symptoms of a serious allergic reaction. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. When taking ibuprofen, it's important to be aware that it may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be greater for older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's also important to note that taking ibuprofen right before or after heart bypass surgery should be avoided. Another rare but serious side effect of ibuprofen is the risk of serious bleeding from the stomach or intestines, which can occur without warning. Older adults may be at a higher risk for this effect. If you experience stomach or abdominal pain that doesn't go away, black or tarry stools, vomit that looks like coffee grounds, chest pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, it's important to stop taking ibuprofen and seek medical help right away. Before taking ibuprofen, it's crucial to talk to your doctor or pharmacist about the benefits and risks of this medication. And as always, follow the recommended dosage and timing for the best results. Before taking Ibu-200, it's important to tell your doctor or pharmacist if you have any allergies to ibuprofen, aspirin, or other NSAIDs. Be sure to also inform them of your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems. It's important to stay hydrated while taking this medication and to report any changes in urine output to your doctor. Ibu-200 can cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's best to avoid driving or using machinery until you know how the medication affects you. Daily use of alcohol and tobacco may increase the risk of stomach bleeding, so it's important to limit alcohol and stop smoking. This medication may also increase sensitivity to the sun, so it's important to use sunscreen and protective clothing when outdoors. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications you are using. Pregnant women should discuss the benefits and risks of using Ibu-200 with their doctor, as it can harm an unborn baby and cause complications during labor and delivery. If you are breastfeeding, consult your doctor before continuing to breastfeed while taking this medication. When taking Ibu-200, it's important to be aware of potential drug interactions. It's crucial to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Ibu-200 may interact with medications such as aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, and diuretics. These interactions could change how your medications work or increase your risk for serious side effects. Additionally, Ibu-200 may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to check all prescription and non-prescription medicine labels carefully since many medications contain pain relievers/fever reducers that are similar to ibuprofen and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless your doctor instructs you otherwise. However, daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen, and make sure to take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Do not increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. If you or someone else has taken too much Ibu-200 and are experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical attention immediately. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. If your doctor has prescribed Ibu-200 for you, it's important not to share it with others. While you are taking Ibu-200, your doctor may want to monitor your blood pressure and kidney function with lab or medical tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you are taking Ibu-200 on a regular schedule and happen to miss a dose, take it as soon as you remember. If it's close to the time of your next dose, then just skip the missed one. Do not take a double dose to make up for the missed one. It's always best to take Ibu-200 at the same time each day to keep a steady level in your body. When storing Ibu-200, make sure to keep it at room temperature, away from light and moisture. It's important to keep it out of the reach of children and pets. And when it comes to getting rid of any leftover or expired medication, it's best to consult with your pharmacist or local waste disposal company for the proper way to dispose of it. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. Remember, always follow the proper guidelines for disposing of medication to ensure the safety of your family and the environment. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.